So medullary thyroid carcinoma accounts for about 5% of the total thyroid cancers in different types. So there's many different types of. The most common one is actually papillary thyroid cancer, and then you have the follicular, and then you have medullary. But it counts for 5%. And there's actually two types. There's a familial type and a sporadic type. In most cases, in 80% of the cases, it's the sporadic one that is actually involved. And typically it will happen in patients that are greater than 45 years old. And the way it actually presents, it's very unilateral. Whenever actually they do an FNA, it's typically cold. When you think about cold, think cancer. If it's hot, with the radioactive nucleate scan, it's going to be more likely not cancer, more like a hyperthyroidism state. And it's actually the most common presentation is a solitary thyroid nodule, which is usually typically present in 75 to 95% of the cases.